Hi everybody, this is Dr. Bobby with Pain Rehab PT. I just wanted to make this video to just share my story of how I overcame chronic neck pain. I had neck pain that lasted for about 3 months. It didn't start with an injury, it was more from stress than anything. But I just wanted to share just about what's different with the work that I do for physical therapy versus traditional physical therapy and how I was able to solve this. So I follow more of the work of Dr. John Sarno. We focused on treating tension myositis syndrome was the condition he called it, but it was more about how emotions and stress can cause pain in the body versus structural abnormalities, tightness, weakness, things like that. And I follow kind of the newer modalities of like pain reprocessing therapy, which is similar to the work that Dr. Sarno did, but it was just maybe the research is just more advanced in treating the brain and the nervous system. So for my neck pain, it actually started from stress. It wasn't an injury. It started in December of 2021 was the time. And at the time, my daughter now is going to be 5 in a couple of months, but at the time she was about 18 months. And at that time, with COVID and everything going on, she had an exposure. And so she couldn't be in daycare. She was out of daycare around that Christmas time. And so I was going to be staying home to help her and take care of her and do all these things with her. And if you know what it's like to have an 18-month-old, that can be difficult. That can be challenging. 18-month-old children can be a lot of work. And I think for me, that was creating a lot of anxiety and stress because I don't know how I was going to deal with just caretaking and naps and feeding and all these different things. And so as that day progressed, the day I found this out that I was going to have to do this for a few days while my wife started to go to work, and I would just be on my own because I couldn't really go get help from anybody at that point since she had an exposure. I just had to kind of take care of her here at home by myself. As the day went on, my neck just got tighter and tighter, more painful, both sides here really. And I didn't think anything of it. I thought maybe it's just, maybe just something just happened during the daytime that maybe I just, my neck just turned the wrong way and I just felt something. So I didn't think, make a big deal out of it. But as the day went on and the night went on, it got worse and worse. And to the point where my neck was basically locking up. And in the middle of the night, I couldn't sleep through like most of the night really, and I woke up in the middle of the night because I couldn't even get out of the bed to just even get up from the bed. And my wife just asked me what happened and what's going on. I told her like I can't. My neck is so painful at this point that I can't even get up off the bed. And so my wife at that point literally had to just help me to sit up at the edge of our bed even, and then she gave me some medication like Aleve or anything, just to help with the pain, just to get the pain levels down so I could function. But so I was able to maybe take the medicine and it helped a little bit and I got some sleep. But when I woke up in the morning, still my neck was so painful. I could barely turn the neck really. It was that painful. And I know some exercises that I do. One modality I use is total motion release, which works really well. And so the one exercise for total motion release is just rotation, where you're basically just kind of going hands on the shoulders like this onto the chest, and you just rotate your body and you rotate it to the side that's least painful, basically. That's the inventor of it, Tom DeLonzo Baker. It's a great program. It's a great exercise and a great treatment. I think sometimes they don't know exactly why it works so well. I think it works really well because I think it targets the brain and the nervous system and giving you safer, more pain-free movements to work through, which your brain and your nervous system like, versus typical therapy might ask you to stretch into those painful areas. If you're tight this way, then you really need to stretch as much as you can. But when you have a neck spasm, stretching your neck is going to be more painful. Your brain and your nervous system are creating a spasm and locking it up for a reason, so you don't move it. So if you were to try to stretch that out, your brain and your nervous system are going to resist that very strongly. And most people do not report that things feel better. They usually say it feels worse. And so that method with doing the thoracic rotation, I was able to just find a side that worked well for me. And I did about, let's say, 30 reps 3 times to the one side. But at least at that time, I was able to turn my neck. And so why the exercise works really well is because just your body and your thoracic spine and everything connects back here all the way to your shoulder and your shoulder blades to your neck muscles and your spine. So at least if this area is really tight and locked up, you can at least move a different part of your body, at least down here, which will still help to loosen that area up. And I think it still gives feedback to your nervous system that in this area, it's still safe to move. So at least it was better that I could move my neck a little bit more. It was still painful. So on that day, in the work that Dr. Sarno teaches and a lot of mind body practitioners might teach is, they want you to focus on treating your emotions and treating with the stress and, journaling and if you're angry about anything. And I get all that because I've learned about this since 2015. So I understand these things and I knew where this pain was coming from. I knew what the stress was. It was parenting and it was the challenge of parenting. But even despite the fact that I knew all that, it didn't turn this off. The pain was still on and it was still active and I still had to parent, so I still had to like function and do that job. I still had to be a caretaker. So on that day, I mean, I took medication as I needed to from the store, got pain patches, icy hot salon pus, whichever ones work. What is it, the biofreeze for like the roller, just anything, because again, you're still treating yourself and you're giving yourself self-care is what you need. Whatever you need to do, if it's heat, ice, whichever, right? Whatever works well for you, it's still okay. It doesn't go against this method because you're still taking care of what you need to take care of. Again, you can have an understanding that your emotions are causing your pain or stress is causing your pain, but it's still okay to try modalities like medication as needed, topicals like the salon pass, like we're talking about, ice and heat. That's okay. It still works. You're still ultimately going to try to work on the goal of what's causing that pain with stress, but you're still taking care of yourself in the time being so you could still function. So at least in doing that and trying all that, I was able to at least function and parent and take care of my daughter. And I got through those days at least. My wife eventually was off because it was kind of that holiday break time, and our daughter was off from daycare. So at least we could all be together, and she was able to help me out too. But even though all that passed, the acute neck pain of those days passed, I still was waking up every morning with like a stiff neck. It was still a painful neck every morning. I would wake up, and even though you know the pain would go away eventually as the day went on. So like it's like wake up with the almost like you slept wrong, right? So you wake up with a stiff neck, and I thought that eventually again that would just go away. But that still continued. This was from December, day after day. First month it's continued. Like every morning was just like that. My neck was still painful. I thought maybe the pillow could be the reason, right? A lot of us think that. So we tried different pillows out, and so I thought to myself, maybe I'm sleeping in a wrong position. So everyone says you need to sleep kind of in this perfect aligned position with your neck, that your neck should be in line with your spine, which it really doesn't need to be. Many people sleep elevated positions, and it feels fine for them. It's okay. It's not dangerous. So I tried that, and even though I got a new pillow, I still had the same problem, and so it wasn't really working. So what I did was I just kind of just went about just living my life. I think that's the point, and I think that's the point of the work that we do. And that's different maybe about this type of work that I do in following Dr. Sarno's methods and the PRT method is we don't try to get stuck on what's going on in the body. Pain, again, I didn't have any injury. If I had an injury, I would have gotten checked out, especially a neck injury. That's serious. But then I know the pain started out of nowhere. I know about this work. I know stress can cause pain. But what people sometimes don't realize, like they can deal with the stress, or maybe they don't deal with the stress, but then they still are trying to solve the problem. They're trying to make it like the neck pain is a problem to solve. And all that does is for your brain and your nervous system, it keeps your body on this high alert active, like there's something dangerous going on. So we got to fix it. And so for the neck pain, which for many people, a lot of the pain they might have, if it's a neuroplastic pain is what we call it, that's the type of pain we're trying to treat here. It's more from the brain creating this pain. And for that type of pain, if you still try to keep solving this problem that's not really a problem to be solved, your brain's going to keep it active and keep it going. And I've had that happen many times, and I'm going to share that more in future videos as well, the different conditions I've been able to treat using this method. But for the neck pain, that's what I did actually. I still work as a physical therapist, and so I still work in a hospital. I'm working with heavy patients and bedside acute care. And I wasn't in any position that I was going to do harm to myself or anybody else. I took medication as I needed to, or like I said, as the day went on, it would go away anyway. And so again, that continued for a few months till the one day, maybe in March, I woke up the one morning and it was gone. And just like that, neck pain that I was having each morning for about 3 months, pretty stiff, pretty painful, eventually just disappeared. And it disappeared because I wasn't trying to solve it and fix it. I wasn't trying to find different stretches or exercises or work on my posture and all the things that we might teach you usually in traditional physical therapy. And that's usually what happens for many people. Sometimes we need to work on triggers, and we got to figure out triggers. For many people as well, they can suffer with different conditions that happen in the body. And if it's a mind body related condition, more from the brain and the nervous system, there could be triggers that are going on. We need to figure out those triggers. So in my case, I know from the stress of parenting has been a trigger for me before, but after I got through that acute phase, and then I was able to, I know about the work anyway. And so I kind of understood what I needed to do and not do. And a big part of this work is not trying to be hyper focused and hyper vigilant and preoccupied with your symptoms, because that creates more fear. And fear is fuel for the fire that goes on in terms of creating pain. And so my pain was gone. And this is why I wanted to share this for people, especially people who suffer with chronic pain. And I'm just focusing on chronic neck pain in this video, but it could really apply to any chronic pain, as long as it's like a neuroplastic type pain. We're not talking about cancer and other diagnoses like that here. Again, this work can, I think, still be helpful for people in helping deal with emotions and stress and mental health. But this is for chronic neck pain in this video. And so that's what I wanted to share with people, just to let you know that, chronic pain, it's depending on the cause, it's treatable and doesn't need to be a problem that needs to be solved. You can, once you rule out all the major, any, structural issues and, anything more serious that could be going on, it's okay to try these methods, and there's more to learn, there's more to teach. But again, one major way that really works is not trying to focus on solving the issue. Okay, so I just wanted to share that in this video. Is just like a starting video. I'm going to be sharing more videos in the future about all the different conditions that I've treated myself for myself personally, but also for other patients that I've worked with as well. And so I just want you, that'll be for the future videos. So again, please subscribe to the channel, as I will be sharing more videos in the future. If you're looking for help, I offer one-on-one consultations as well. Again, so you could just reach out to me at painrehabpt.com if you're looking for help. Okay, so thank you again for listening, and I'll talk to you soon. Thanks, bye.